My name is Vanessa, and we're doing our presentation on drug adherence. First off, I'm going to give an introduction. So, medication adherence can cost billions of dollars a year worldwide, and it can also lead to premature deaths as well. And there is an estimated of 67% of Americans with prescriptions that are non-adherent. So, as discussed before, billions of dollars are wasted a year due to adherence, and there's been a shift in the paradigm from acute needs to chronic needs. And the definition of drug adherence is taking prescriptions as prescribed without any modifications. There are two types of drug adherence, intentional and non-intentional. So intentional is refusing to accept diagnosis or changing the dosage. Unintentional is forgetting to take the drug regimen, or if the regimen is too difficult to understand. And later we will discuss the 5 factors of drug adherence, which could be society and economic, healthcare system, specific condition being treated, as well as complex therapy and patient-related factors. And in our drug adherence plan, we're focusing on the patient factor, and we decided that patients are not to be blamed for their lack of drug adherence. Therefore, our pharmacists need to be more active in medication adherence interventions, such as because biomedical technology and access to medication won't be enough. And then next, Melanie is going to talk about who it affects.
Hi, my name is Melanie. I'm going to talk about who is involved and who this affects the most. So this medication adherence problem starts right when the patient is given the prescription. It's a provider's role to basically educate the patient and make sure they have all the information they need before taking their medication regimen into their own home. Because at that point in their therapy process, they have the authority to either help their healthcare issue or maybe even make it worse by not being non-adherent to their regimen. Overall, the system is affected because the patients aren't receiving their desired outcomes, and they're going to come back and increase their medication costs and healthcare costs. So that's going to overall affect the system, and it's going to show that it's not being effective and that it's not working. The way that we can improve the situation is through education, attention, and empowerment. When the patient feels that they are comfortable in taking their medication into their home and into their own hands, they'll be able to improve their healthcare lifestyle and be able to work with providers with their therapy regimen.
My name is Joseph, and I'll be talking about ways to increase adherence and lower the amount of errors due to improper knowledge by the patients. One big way to reduce this is by counseling the patients upon picking up their medication. As pharmacists, we should make sure that the patient knows everything about the medication, the side effects, the doses, when to take it, and also provide the patient with an opportunity to give their concerns about the medication, ask questions. Also, we want to highly encourage follow-ups. As the patient is taking medication, they could come back to the pharmacy, explain why they feel like the medication is or is not working for them, and the pharmacist can derive a way to address their issue. Another big problem is forgetfulness for these patients. A lot of them just simply forget to take their medication. To cope with this, there's been techniques seen as such as using a pill box so that the patient can follow their daily schedule, and also giving them text message reminders if they have complex medication regimen.
Hi, I'm Kristen, and I'm going to talk about the adherence program that we created. We decided to call it the Advanced Adherence Program because we decided to use a multi-measured approach because that's what the literature suggested as the best way. So we decided to approach this one way using subjective measures that focus on patient attitudes regarding their medication regimen. And we decided to combat this by focusing on consultation by the pharmacist that utilizes motivational interviewing and the teach-back method. We also decided to implement pharmacist follow-up within 24 to 72 hours just to make sure that the patient is responding well to the medication and maybe to kind of review some things that they missed during the consultation at the pharmacy. And then when the patients return for refills, they're going to be given a questionnaire to fill out so that the pharmacist can gauge how it's been taking their medication. So next we decided to approach this using objective measures that focus on external factors influencing a patient's behavior. We decided that simplifying the medication regimen using computer software and the medication regimen complexity index would be a way to gauge if the patient is going to be able to adhere to their regimen. And then we also decided to make it easier by introducing unit dose packaging. So kind of like what you see here, that's just a way for the patient to make it easier for them to take their medications because every single one of their doses is split.
Hello, my name is Matthew. I'm going to be telling you about how we're going to have the pharmacist actually implement this adherence plan into the pharmacy. So right off the bat, when the patient first walks into the pharmacy, they'll actually see the pharmacist working at the front counter. Normally the pharmacists often are hidden in the back and the patient just gets to talk to the technician, but we want the pharmacist to be the first line of contact for the patient. And when they give their prescription to the pharmacist can immediately check for medication appropriateness, allergies, and possible drug interactions that the patient might have with the prescription that they just got. And this will save time in the long run because if they end up realizing one of these mistakes later when the medication's already been filled, it's kind of just wasted some of the pharmacy's time. So it's better to check this before you refill the medication. And then following filling the medication, the pharmacist will engage in patient-centered counseling. This involves using a private or a semi-private room, which should be implemented in the pharmacy. And during this counseling, the pharmacist should be asking 3 important questions to the patient. The first one being, what did your doctor say this medication is for? Also, how did your doctor tell you to take this medication? And lastly, what effect are you expecting from this medication? This is a good way to gauge. Well, first, it's a good way to make sure that it's the correct medication, and once again, that's been given to them from their prescriber. And it's also a good way to start gauging patient adherence. They should also ask the patient to teach back to them what they have just learned to make sure that the patient will be taking their medication correctly. And then after the patient leaves the pharmacy, again, we're going to implement a follow-up system, calling the patient within 72 hours, making sure that they're taking their medication and that they're taking it correctly. And then we're also going to be texting patients for refills when they're going to be due, just to remind them, and that should hopefully help with their adherence.
Hello, my name is Angie, and I'm going to be talking about the practitioner buy-in. We believe that the practitioner can play an important part in the program, in the Advanced Adherence program, since it is the first place where the patient goes before they can come into the pharmacy. And we thought about talking to the practitioners and informing them about their important role in the adherence program. And to implement our program in the PCP office, we thought about encouraging the PCP, first of all, to use the Advanced Adherence program. And that is through providing them with the history of the medication adherence of the patient so that they can have information about the adherence of the patients to the medication, and therefore they will not be prescribing other medications thinking that the first medication is not working. Another way is through phone calls, which was previously mentioned. So the pharmacist will be calling the PCP office to get updates about the case or the status of their patients and to discuss their medications. And also we thought about the single dose packaging, as mentioned before, and we can inform the PCP office about that so that they can have that in mind, and whenever they are consulting the patient, they can also mention that to them. And lastly, we thought about using surveys to clearly understand the side effects and the causes of the non-adherence that the patient can face, and therefore we can target these causes to better address the adherence problem.
Okay, so in any business, cost is always the question. So we looked up a couple resources that we found that might to see how much the unit dose packaging machine would cost, and we found that it could be around $10,000 to up to over $20,000, which seems like a lot at first. In addition to that, if a private consultation room isn't already within a current pharmacy, we have to build one, which should cost around $120 per square foot, as well as training for the staff, because most community retail pharmacies don't have a unit dose machine that they're familiar with, so you have to train them. Pharmacist average is like $55 an hour, and pharmacy techs are $15 an hour. So depending on how quickly they can learn, it could cost a lot of money out of pocket directly. And also indirectly, because of the amount of time it takes to basically instill this program that we developed. It'll take time out of the pharmacist's job from verifying prescriptions, other stuff besides counseling. So the amount of prescriptions that are filled each day could be reduced at first. But it's important to think of the bigger picture. The startup cost will be high, of course, but it'll be offset in the long run, because if we're improving adherence, that reduces the amount of return to stocks that the pharmacies will do each day. And I know that's a big impact on current revenue, as well as showing confidence into physicians and prescribers that maybe having a program installed that improves their patients, they'll begin to send patients to our pharmacy. So that's another big thing that will offset costs in the future.